Welcome to the Shut Your Mouth podcast. My name is Bree. We're a health and wellness podcast focusing on sleep, breathing, and airway. We'll be chatting with leading experts, sharing patient journeys, and getting to the root causes of issues plaguing our society. So shut your mouth and listen up. Okay, so I'm really excited because today is really our first patient journey. And we're going to be chatting with Melina, who I've had the honor of knowing now for probably like the past 6 months, year, I believe. She's just so incredible. And a couple of Fridays ago, we really got to hear her full story of her journey to airway dentistry and all of the life events that led her here and connected her with Toothpillow. And it was there was not a dry eye in the room. It was so powerful. And she is just the epitome of a mom advocating for her family and for herself and for her health. And she did such a beautiful job, even though she was given many hurdles and setbacks and providers who do not understand. And so we really just wanted to give her a platform to share that, to maybe help another mom who is in a similar situation. So she's going to share, she's a twin mom, she's a NICU mom, an IVF journey mom. She's gone through adult airway, she's navigated airway dentistry with her kids. So if any of those are familiar to you, you're especially going to enjoy this story. So I just kind of want to open the floor, Melina, and just kind of let you share with us how you got here.
Yeah, thanks for having me. Like you said, I have many pieces that of my story that have gotten me to where I'm at today, and I believe that they have all kind of played their part in leading me full circle back right where I'm supposed to be. So, thank you for allowing me to share this. 13 years ago, me and my husband got married. We just celebrated our anniversary on the 1st, 2 days ago. So, of course, we didn't get to do anything fun or special because we're knee deep in the sports world right now. But we were at the same ballpark, so that if any sports moms out there that are dividing and conquering, you'll understand how special that day was, just to be together in the same ball field. But we knew that we wanted to start our family right away. So we got married, and we just like any couple that's trying to have a baby, the waiting game starts. And we just kept waiting and waiting, and nothing was happening. And so I sought out the help of an IVF specialist in the Dallas-Fort Worth area. And we started, just with some of the IUIs and just some of the less invasive options. And we did that for about a year before we moved into our first IVF cycle. We never, even throughout the IUIs and everything like that, never had a positive pregnancy test. And so moving into IVF was just the next steps. So we transferred 2 embryos, and my retrieval was successful. I had several to freeze after that, thankfully, but we transferred our first 2 embryos, and instantly I knew I was pregnant, and things started happening really, really fast. By the time my first ultrasound came up, they were like, well, we knew the possibility was high for twins, but they told us that we were actually having triplets. And that came as a shock, just because, it comes with IVF comes with those risks of having multiples, and it is a higher chance of the embryo splitting, but it wasn't really something that we thought would happen to us. But regardless, we were excited. We were thrilled that it only took that one cycle. And we just kept monitoring with our fertility specialist, and we're at our last, our graduation appointment. And unfortunately, all 3 babies had passed right around the same time. So we had been monitoring this pregnancy for, from the very beginning, when you find out you're pregnant, which is about 4 weeks along. And then you find out around maybe 6 or 7 weeks how many babies. And then by the time we were at the 12-week mark, none of the babies had a heartbeat. And so that was a really tough journey, just because, you go through the waiting game so long, and then right off the bat, it's successful, and you almost feel like, oh, a sigh of relief, like this is over, like we made it. And so it was pretty eye-opening once we experienced loss of 3 babies, and it really just, it put it into my heart, just like how, fertility treatments are so common now, and back then they weren't as common, and more people were struggling silently with fertility issues. And so that really put it into my heart to help others. I'm just like I'm an empath, and I love helping people. So naturally, I joined a nonprofit in Fort Worth called Gathering Hope. I think they're out of Aledo, actually. And I started working alongside lost moms, and just started to build my just my servant's heart, and just doing things that really allowed me to help others through my time of heartbreak. And so that was it was a cool time of my life. I met a lot of really neat people. I was able to start Oklahoma City's first gathering, which was extremely successful. It was a beautiful event and a beautiful evening, and we still have one here today. So that was really cool to be a part of that.
And just sorry
Yeah.
to interrupt you. I was just gonna say, like, it's so beautiful when you can take something that's so hard and tragic, but just kind of turn it into a way to help others. And I know when I've been in places of heartache, and I can always tell, because everybody tries to comfort you,
Yeah,
and not everybody says the right things, but they have good intentions, and they're trying to do
absolutely.
what they
Yeah.
can, but they've never been there. And then you'll have that one person who says just the right thing to you, and it's because they were in your shoes, so they know exactly what to say. When my mom passed away, I believe it was my mom, I was like, all this time had gone down, and I had a friend send me a really sweet letter, and she wrote in that letter, "I know the letters have stopped, I know the flowers have stopped, and I know this is when it, like, really sinks in, so I wanted to send." We're already getting emotional here. "I wanted to send this to you because I know that's when that happens," and it's because she also experienced loss. So
Yeah.
I just love that you turned such a hard thing into a beautiful thing to help others.
Yeah, and it does, right? Like, people forget, and they move. People have lives. We all know that, and we move on, and it doesn't make it any less hard. Like, all of my friends were getting pregnant, and every time that you go to a baby shower, or anything, anytime when you're in the same phase of life with multiple people and friends, it's heartbreaking and exciting, and you're allowed to feel both. Like, you can experience joy and in the heartache. And for me, helping others is just a way to work through that. And it's been no different through any other struggle. I don't know if it's just that people struggle through things so silently. But I feel like I go through things and nobody else is experiencing that. And that's just, I think a lot of people feel like that. And so that's why I feel like with every struggle, finding a way to just help one other person not to have to feel so alone in that it wasn't necessarily like what I set out to do, but it just, through every trial that we've encountered, that was just kind of like the next steps. And it wasn't that I sought out to do that. It was really like these divine interventions that just put me in places that allowed me to do that. And so moving to Oklahoma City was no different. We had our twins, which I'll go into this in a minute, but we had just found out that we were expecting Maddie, and I had two 11-month-old babies. My husband was working out of town 20 days a month, and he had the opportunity to work in the office and be home more. And so it was a no-brainer to move, but it was like, that was like our community. And it's cool to see like how things do end up working out, and just, how you can't plan. I could have never planned for any of this to really take place the way it did. So,
Yeah, tell us about the twins. So
yeah,
we so that's like a little sneak peek.
yeah,
There's the highlight
yeah.
of
That's
this.
like
So you
fast
lost,
forward a couple of years.
yeah.
We did
So
3
you
more rounds of IVF that were unsuccessful, and after having the very first cycle was successful, we weren't worried about it working again. We just, knew that, okay, we've just got to go back and do it again. And the hormones are awful. The process is awful. It's kind of like childbirth. You block that part out of your mind. But it's not a fun experience. So I say that lightly, like it's not just you just go do another cycle. Like there's so much that goes into it. And but regardless, we did 3 more cycles, and none of those ended up being a positive pregnancy like a viable pregnancy, which was really disheartening because it was like, gosh, what is happening? And so we decided to take a break from treatment just to like give our minds a rest. And because it's a lot. It's time consuming, it's mentally consuming, it's emotionally consuming. And so we just needed a break. And so we took a break. And once we decided that we were ready to explore our final options, we knew that we didn't want to do another fresh round of IVF. Like we didn't want to do another retrieval. We had 2 embryos left. And so we started exploring other options. If that wasn't going to work, adoption, possibly surrogacy. And it just seemed like every path that we thought, maybe let's explore this, there was a roadblock, even down to my cousin offering to carry a baby for us, which was so incredible just to have that support and love and thoughtfulness. Like somebody offered to carry a baby for me. That's a lot. And she was turning 40 that year. And so she was like, if we're going to do it, we need to do it. Like we need to do it now. So we started some blood work, and even like my husband's blood mark, I don't know, she had to get RhoGAM shots for her pregnancies. And so we knew her blood type was, a possible complication. And we ended up doing the blood work, and their blood types were not compatible. So it wasn't going to be like the safest option. I think you could have possibly, I don't know. But anyways, regardless, it wasn't an option for us. And again, another roadblock. And so we just decided like, okay, if these are the last 2 embryos that we have, this is what we're going to do. We ended up seeing a different provider for our last cycle who we felt like would be able to give us the best chances. And he actually made me sign a agreement because he doesn't typically, with his success rates, doesn't typically transfer 2 embryos anymore because his success rate is so high and there are complications for multiples. And so, I had to like sign my life away, just understanding the complications of multiple pregnancies. And I just emotionally couldn't do 2 transfers. Like I knew I wanted to be one and done. And we did get pregnant with Mackenzie and Jackson. And pregnancy after loss is hard. It is, my computer. It is really, really difficult. And so it seemed like every little thing I was constantly questioning, like, are the babies okay? And, fortunately, I had a high-risk doctor that was doing screenings and scans more frequently. But by around the 20-week mark, we did the anatomy scan and everything checked out. And so we kind of spaced out those appointments a little bit more. And around 24 weeks, I started to experience some severe cramping. And granted, it was the summer. It was August, I think, by that point. And, I just get the typical, like, well, are you drinking water? Go home and rest. Like I had a really long walk from my car to my job. Just the typical things. And I luckily had an appointment scheduled, like just a regular screening with my OB. And they just told me like, bring it up at your next appointment and we'll address it. And so that was at 26 weeks. And They weren't going to do any monitoring or screenings or ultrasounds. I don't know why. And so I just asked, like, the appointment was over and I was expecting to go to another room to have an ultrasound. And they were like, nope, we're good this month. And I was like, I brought up the concerns again and they were like, okay, well, I guess, let me talk to the doctor. And so they talked to the doctor. She ended up doing a cervical measurement. And they ended up sending me straight to labor and delivery. So I was 26 weeks? No, 24 weeks. So I guess my cramping started a little bit earlier. Can't remember the exact timeline, but at 24 weeks, I was admitted into labor and delivery, which, if any of you that are listening know anything about the timeline of viability, that's like right there. Like, we're just past viability. And of course, the first conversations are, we need to stop your contractions. Your cervix is shortened, extremely short right now. You are having contractions. We're going to keep you here and monitor you. But, let's have conversations with neonatologists just in case. And, they just don't have really a whole lot that they can say. Like, they don't know what the babies are going to be like. We're talking like down to the hours, like every hour we can keep you pregnant is better. And then luckily we were able to stop the contractions. They were able to do what they needed to do to get me stable. And so we were having like daily conversations, and then it switched to every day is, just they're growing leaps and bounds every day. It's less time in NICU. And luckily I was able to make it to 30 weeks. They were born just shortly after 30 weeks, and their birthday is tomorrow. And they're turning 8. So it's just, even though I planned like an early possible, right, early delivery, I was young, I was healthy. There was really no reason that I should have had that early of a delivery. But now, knowing what I know, sleep disorder breathing and sleep apnea, the rates of early birth on the babies is so much higher because you're not breathing. And so I did snore quite a bit while I was pregnant, and have had some like airway stuff that I've now learned about. Just, I look back and can see, like, throughout my life how it has impacted me, and that has driven me to advocate for my kids now. So,
And I wanted to add to that, you just said the word advocate, because this is kind of the first example of, like, they were ready to send you home.
yeah,
And that you would have gone home and maybe your contractions in labor would have intensified, but you were like, no, I don't feel like I want to be checked. And you knew, and you kind of like pushed for that.
yep,
And sure enough, got sent straight to labor and delivery, where, I mean, you spent the rest of your pregnancy. So it just goes to show, I think, in this airway space, and we talk to a lot of moms that are dismissed on many levels from many providers, and you really have to push for it and to do your own research and to look for alternatives and not just take answers as they are, because it's really easy to do that. The doctor says and you just listen, but like learning to trust your gut and to just educate yourself on different topics, so that way you can just be prepared for that. And I know that, I'm sure we're going to get into the NICU journey with the twins, but it continued there,
yeah.
you kind of advocating.
Yeah, it sure did. And, advocating all of these things, like I said in the beginning, is just little touches that have led me full circle. And advocating has been part of every single one of them. And it sucks to be a mom that is advocating for your kids who is told, oh, well, their blood work looks fine, or I don't know what else to tell you. Like, that is not a good place to be as a mom who visibly can see, and maybe some don't. I talk to a lot of moms now that don't even know that what they're seeing is their kiddo struggling. Like, it's just so normalized now that a lot of people don't know. And so, yeah, advocating is a huge part. I advocated then, and then of course, when they were born, they went to NICU. They were born at 30 weeks, and they did go to NICU, but were really feeders and growers. They were not very sick. Jackson did end up getting like a really serious, it can be a really serious infection that a lot of preemie babies don't survive. But we had the most incredible NICU team, and they caught it right away, and they were able to get him on the antibiotics that he needed. It's like I don't know if it's intestinal infection or like, I don't really know, NEC maybe, I'm not sure, but they caught it very early. He was intubated and on a vent for 24 hours, so very minimal time there. Mackenzie was only ever on CPAP. They were placed on feeding tubes in the beginning. And that was really where the first, like, we're learning how to take care of these babies that are tiny. I was on magnesium for 24 hours. So I was so incredibly sick from the delivery. So I didn't even get to meet them until quite some time after. And I couldn't even sit up on my own. Like, they had to sit me up and then like pivot me into a wheelchair. It was like the most out of body experience ever being on magnesium. It was awful, but luckily they're just, NICU nurses are angels, and they, helped Wes with learning how to care for them. And he would walk back, as I'm learning to pump and trying to sit up after a C-section and all of those things. He would take the milk back and forth, and they, swabbing the inside of their mouth even before they're consuming anything. But yeah, their feeding journey really is kind of why I'm here today. But it was just interesting to me, because while we're teaching them how to eat and trying to get them off of their feeding tubes, they're also losing weight because they're having to put forth so much effort to learn how to eat. And it's so much work for their little bodies. And I wanted to nurse so bad that, like, whenever I dreamt about being a mom, like, that's what I don't know why, like, that seems a little weird, but
it's not, I'll say it's not weird.
I just feel like that bond is just something that I don't know. That's something that I wanted to do. And they obviously, like, they just worked so hard to eat. They were so small. And I just, like, reasoned with myself, and I was like, okay, if we're going to get out of here, we need them to eat off of a bottle. Like, nursing wasn't going well, but their mouths were so tiny. So that made so much sense to me. Like, let's get them eating, let's get them out of here. But before they were even on bottles, the struggle was they would have reflux from the tube feeds, and then they would have like breathing episodes where they would stop breathing. And so every time that those happened, it restarted like when their discharge could be. So they had to stay there a certain amount of time with like episode free before they could leave NICU. And so
I have a nephew that was a NICU baby, and I remember that. Like, there was like or you'll get to the car seat test, and you're so excited because you're about to go home. You're about to go home, and then they fail the car seat test. And you just start over, and it's just like devastating to, like, it's so refreshing.
Yeah. And it is like always 3 steps forward, 1 step or 2 steps back, really, with anything in life, right? But and having those expectations were good to know, like, this is normal. But we started wondering, like, well, you're feeding him and he's having reflux. Like, let's slow down the feeds, right? So he's not like being overloaded with all this milk. And the other half of that is so we started they suggested to lengthen the feeds, right, over a longer period of time to stop the apneas from happening. But then it was time for his next feed, and he just got finished with his tube feed. So then he's not hungry for his bottle. And then it's like, and they're on 3-hour schedules, and it was really difficult. And so Wes was like, don't you think like he's not hungry or something because we've just fed him over a period of an hour and a half, and then, in 2 hour or an hour and a half later, we're trying to feed him a bottle. And so they were like, yeah, that makes a lot of sense. But the reflux kind of, it just like, it makes sense that the esophageal sphincter is open with a feeding tube, right? So it makes sense that the reflux comes up. But now, knowing what I know now, like even the swallowing and, like when it was so full circle. And so that was really another time where we had to advocate and just really get to the bottom of like, well, why do you think this is what is happening? Like, let's brainstorm, let's talk through this, like let's try to think outside the box here. And so but feeds did continue to stay a struggle, and we eventually got them to eat out of a bottle and got discharged. And even on the night, like you stay in with them before you're discharged. And so we got to go to the hospital and stay with them. And Jackson stopped breathing. Like he drank his bottle and he spit up and it came out his nose. And we were like, what are we doing? Like, we're not ready to go home, but we desperately want them back home with us. And yeah, it was just, they struggled to eat. They had reflux. I asked, like even lactation would bring me back to the hospital to help me learn how to breastfeed them. And they would only ever take an ounce. And so I was triple feeding at that point. And it was just, and then you're hormonal. And in between that time, I developed pancreatitis and ended up having to have my gallbladder out and was in the hospital for a week. And it was just like, I give up. Like, okay, I hear you. Let's just bottle feed them. It's fine. But then it turned into, well, they wouldn't take my breast milk. They wouldn't eat out of the bottle. They took 45 minutes to feed. And eventually my husband had to go back to work. And although they were sleeping fine and they were eating well enough, like I was able to get ounces in them and they were growing, it was like I had to pump and then wash bottles. And even when I did have help, there's still not a lot of time for anything else. And so, yeah, it was just constantly a struggle. And I mean, they had torticollis. And so we had physical therapy appointments and chiropractor appointments. And all of these people I asked, like, do you think that their tongues could be involved here? And the only reason I even thought that was because during our fertility journey, I had an amazing nutritionist that I was able to learn from and work with. And in Fort Worth, her name's Amy Gonzalez. And she taught a nutrition course, and tongue ties were part of that. And so that was like my introduction to even what tethered oral tissues are and possibly why we have more prevalence of those now. But I asked everybody and they said, no, you're just preemie twin normal things that everybody goes through. And I'm so sorry that you're struggling, but maybe by the time they're 1 and they're not on bottles anymore, they won't have as much spit up. And so that's kind of the milestone that we looked forward to. And then, like I mentioned earlier, when they were 11 months old, I found out I was pregnant, not like naturally, which was a huge shock. And that same week, I found out we were moving to Oklahoma City, and I was devastated to leave our network. And we had like a group of moms that lived in our neighborhood, and one of them had a pool, the other girl had a garden, I had a big shop, and it was just like we had things to do. When you're in the thick of motherhood and you have like newborn motherhood, like I felt like I won the lottery. Like I could get out of my house, but also like, I didn't really have to leave my house. And so I did not want to move. And, but here I am in Oklahoma. Yeah.
You had your tribe.
I did. Yeah. Our family lived there. It was just, yeah, I didn't want to leave that.
So now you're in Oklahoma. You have 2 very little twins, 11
Yep.
months. That's
Yeah.
tiny. You're
Yeah.
pregnant again.
Yeah.
You just came off of this wild roller coaster, and now you're trying to kind of recreate that tribe in Oklahoma.
Yeah.
So, kind of walk me through what happens now.
Yeah. So I joined a local MOPS group. I was in MOPS in Texas, and that was, it's amazing to have like your tribe, but I was so bitter. Like, I guess I just hold on to grudges. I don't know, but I just hated it here. Like, I remember, and of course I was pregnant. So I just remember getting gas, and it's windy here and it was cold by that point. And I just was like sobbing, like getting gas because I was free, like stupid. I was on the side of 35 getting gas, and it's so windy. And I'm like, I hate it here. But it takes a long time to build those relationships and friendships. And, having a connection like MOPS was really helpful. But I also lived a little bit further out, and just two babies, like nobody wants to leave the house with two babies. And so, or two toddlers by that point. Um, I guess I need to go back to, so when we were still in Texas, my husband went back to work, and the feeding struggles were really difficult to manage. I ended up hiring Sleepwise Consulting to help them sleep through the night and get on a more predictable schedule. Definitely age appropriate for them. I knew still feeding overnight was a possibility because of their size, which is totally fine. Like they work with, and I now work for them too, but we work with all families to create a sleep plan that works for their family. And so they were very generous, and they understand, the need for feedings and, attachment and all of these things. And so, anyways, I'll go back to Oklahoma now, but the twins slept well, but they always were just on the whinier side. They just didn't seem like they ever slept, like the quality of their sleep wasn't great. Which I grew up like that. Like I could sleep 12, 13, 14 hours a night and not like just always be tired. And so, anyways, I hired Sleepwise for the twins, and they slept great, but the quality, I just knew like there's something missing here. And so by the time I had Maddie, they were 18 months old, and I hired Sleepwise again for our newborn program because I knew having three babies at home, like my husband was working in the office, but he's still in an office all day. I still don't have a lot of help. And now I'm in a place where I know very minimal people. And so they were gracious enough to work with me a second time. And so that experience really, I wanted to help other moms because I was able to parent three kids under 18 months and take care of myself. And I felt like that was really important because there's a big stigma between having kids and never sleeping again versus like losing yourself in motherhood. And so I knew that I wanted to join their team, and I got to a little while later, which is really exciting. So I can help families that are having sleeping troubles with their kids. But when Maddie was born, keeping in mind that up until this point, like none of the OBs would see me because I had a prior high risk pregnancy. I moved here when I was 12 weeks pregnant with Maddie. And so like, I didn't even get to find a provider until like several months into my pregnancy, just dealing with hurdles and complications from that. But luckily I found an amazing provider. And when she was born, she had the same complications, like not with the apneas, but like it was painful to nurse. She couldn't transfer a lot. My nipples were cracked and bleeding. And like from the NICU experience, I learned like, oh, you can do saltwater dunks on dip your nipples in salt water to like help the healing process, and similar to like those silver caps that you can use and stuff. But it's like, why isn't anybody looking into why their nipples are bleeding? Like that is not good. And I hear all the time with my clients, like, oh yeah, it was so painful for the first couple of weeks, but it's fine now. And so if any of you have had that experience breastfeeding, there
I
can be an underlying issue.
Yeah, so I did that with my first son, going back to, like, breastfeeding, like, I wasn't super attached to a birth plan, like, however the
Yeah,
baby gets here, I didn't have any type of longing for that, I just wanted the baby, but what I longed for was, like, a breastfeeding journey,
yeah,
and I had, a mom and a sister and a sister-in-law who were just milk-making machines, and,
yeah,
like, they could make so much milk, but on top of that, they could just it was so easy, and then so I just had it in my mind, it was just gonna be easy, and then my first son, it was so painful. I remember I would, like, hold my breath and cry for the first 5
yes,
minutes of his feeding, and
yeah,
then just get over it, and then, of course, he wasn't getting enough, he was cranky. Um, it was a new baby. I remember, like, first time mom, I went to the pediatrician, and for whatever reason, um, they took longer than normal for this day, and then he was getting hungry. I was not the mom that felt like I can just try to nurse him here in
yeah,
this like, 'cause it was
oh,
new, right?
yeah,
So
yeah,
now I'm like, "He needs to eat," and then I just broke down crying. I
yeah,
didn't even have the appointment, and eventually throwing in the towel, finding out he had a tongue tie all this
right,
time, but, like, I just felt like we were so gone, it's,
yeah,
like, not even worth it at this
right,
point. So we never addressed the tongue tie because I felt like, "Well, why? We're not nursing." Now I know why that needed
yeah,
to be addressed. It
yeah,
still affects him, so we
yep,
had to do that later in life, but my second son came, and so in the hospital, I was like, "You're getting this here." So, like,
yeah,
they clipped
yeah,
it in the hospital, and I experienced 0 pain,
yeah,
like, none, and it was,
yeah,
like, the craziest thing. I'm like, "When are they gonna start hurting?"
yeah,
And
aw,
they never did, and it
yeah,
was just like, gosh, it makes me so mad, like, I wish I could go
yeah.
back in time for Leo, um,
Well, and
but you just
I
have
mean,
to
the hormone shift after you have a baby, like, I'll get into this in a
yeah,
minute, but after I had Weston, I cried for like, gosh, I don't even know, like 5 hours straight. It was, and I was like laughing through the tears because I knew it was, that was my third pregnancy, and I knew what was happening, but I just couldn't stop sobbing. And so it's
I
just the hormones and trying to deal with that and the frustration, and then
the
to
lack
be
of
told like
sleep,
it's no normal, like that is not normal. So yeah,
and
it's yeah,
it gets into your head because you see
yeah,
other people doing it so
sure.
easily,
Yeah,
and I vividly remember the first few weeks, I had a sister or aunt or somebody helping me, and then there was this day where it was just me with Leo for the first time, and Joel went to work, my husband, and he wasn't eating, he was crying, I didn't know what to do, so I called my husband, like, hysterical, and it was kind of cute because in Texas, they make you watch that video before you
yeah,
leave, the shaken baby video,
mhm.
and so my husband could hear the distress on my body that he was starting to quote it, he goes, "Lay him in the bassinet, walk out of the room, shut the door," and I started like, "I'm not gonna, like, shake him, I'm
Yeah,
just like, I don't know what to do,
yeah,
like, come home
yeah,
right now,"
yes,
and it also goes back to just, like, to tie it back to sleep is, as a mom, when you're a new mom, you're so sleep deprived, you're not functioning well, and there's so many kids and adults out there that are not sleeping well,
yeah,
and the behaviors and the way they're acting, nobody's linking it back to their sleep.
right. Yeah, yeah, it is crazy, and I'm so thankful that I have been able to pick up on these things, and like you said, like, just following your gut is so important as a mom, and it's okay if you don't have those gut feelings, but, if you do feel strongly about something, I always tell people, like, even if what I'm telling you doesn't feel right, like, follow your gut, dig into it a little more, even if it's just that touch point, like, yeah, yeah, the lack of sleep is something, and it's been really fun to be able to, like, help change that narrative and shape that narrative a little bit different. I got to work with a lactation consultant, who was a referral from my NICU team in Fort Worth, and she didn't know about tongue ties, and we definitely I was able to identify some things through his feeding and sleeping patterns, and got her into a provider, and sure enough, she was so grateful that I was able to teach her, and she felt so bad because that's what she does. Like, she's a lactation consultant, and she didn't even fully understand the tongue ties and the implications that they have with feeding. And so her testimonial was amazing because she basically was talking about, like, I'll have to find it and see if we can post it, but it was incredible because it just talked about like good sleep and good breastfeeding relationship. You can still have both. And so it was really cool to be able to work with her as well. But I did join the team. I still work for Sleepwise. And I had 3 babies under 18 months. And that's kind of what drove me to want to join their team and be a mom, right? Be at home and still be able to raise my kids and have something for me. It gave me something to do. I love helping other people. And so it fulfilled all of those little buckets. So I had Maddie, and sure enough, she had the same issues. And again, they were like, no tongue tie, no nothing. And so they suggested that I come up to their lactation department every week. And I'm like, I've got 2 18-month-olds. Like, that's not just an easy feat to like even get in the car. Like, it just wasn't, it was so hard. And yet I made it there because I really felt like they were going to be able to help me nurse her. And I was so like, I didn't get to do it the first time. I'm definitely going to do it this time. And so I did whatever they told me to. And by the time she was 8 weeks old, they were like, I don't know what to tell you. Maybe go see this person. And so luckily they sent me to a midwife who was able to diagnose her because RNs can't diagnose tongue ties, something with the licensure restrictions, which is a lot of IBCLCs were RNs. So I think that there's like, I don't know how that's not their scope, but regardless, there's a lot of like disconnect there. And so I was able to see the midwife who did craniosacral therapy, who really taught me a lot about the fascia system and all of that. So at 8 weeks old, we had Maddie's tongue tie released. The dentist who released her confirmed that the twins had tongue ties. I did do a release on them when they were 2. Now I know a little, now I know more. You kind of just do what you know, right? And so no fault on that. Just now I know better. And so that's not what I recommend, but that was the route that we took. And even though I asked, like, I had heard a little bit about palate expansion by that point. And I asked the dentist who did their releases, and she was pretty confident that a tongue tie release was going to be the end all be all. And, you just kind of take what they say and hope that they're telling you the right thing. Eventually I stopped doing that, and we'll get into that here in a minute, but we had her tongue tie released, and I was like, well, maybe I have a tongue tie too. And so she did an evaluation on me, did a tongue tie release on me. And of course, like, I had a lot of symptom reduction in like my headaches and like tightness in my shoulders, but we didn't address any of the root foundational things. And so now I'm in airway treatment after I met Dr. Hansen. But my network just kept growing little by little. I started in the sleep community, and I really started just taking my experience and my kids' journey once I was trained and knew kind of like the sleep education. And I started noticing things in my clients that were like, we ask a lot of things in our questionnaire about feeding and birth and history and things like that. So I'm picking up on some of those red flags. Like, if they tell me it hurt to nurse, we'll dig into that a little bit deeper. But sleep is driven by feeds when they're little, right? Like, if they're not full, they're not going to sleep well. And we also know that it's driven by breathing. And a lot of these kiddos that I'm working with that are coming to me are not sleeping at all. Like, they're waking up every 20 minutes overnight. Like, the parents that come to me are in complete desperation by the time that they have reached me. And so it's just one of those things that I feel like, I don't know, most of the time they're coming to me. I don't know like a percentage off the top of my head, but I started picking up on things with my clients that, okay, these are the trends and patterns that I see that I saw in my kids. And it started to hold true to a lot of my clients. And so I've kind of worked backwards to figure out like, that really, like, the correlation is there. So I started doing my own continuing education. I don't have any like licenses that would like, it would, like you get credits for it for your, if you're an SLP or a dentist or whatever. But I just started taking these courses because I was so sick of giving bad information, and I wasn't going to be given bad information anymore. And so I started taking these courses that really helped me figure out and identify and confirm like I was thinking right. Like this made sense. What I'm seeing is right. And really the data kind of just showed that. But after
Yeah,
the
and
twins, oh, go ahead.
I was just gonna, and maybe you're already headed this way. I just kind of, you briefly mentioned Dr. Hansen, and
Mhm.
I was just kind of wanting to kind of guide you into sharing a little bit more about that.
Yeah.
Your airway journey with yourself and your kids, and how long before you knew about Toothpillow, because Dr. Hansen is our tooth pill provider, but you knew
Yeah.
him just long before we existed. And so I just kind of was kind of steering you that direction to share
Yeah.
that story.
Yeah. So with that being said, the twins were just, I could tell the sleep quality wasn't great, but I didn't know what else to do about it. We see a pretty functional practitioner here. And, I was already doing all of the things that I thought I could be doing. And by the time we ended up getting pregnant again, very surprisingly on birth control this time, just crazy how life works out. But we ended up having another baby, and right around the same time, the twins, well, Mackenzie specifically, she was not able to control her emotions, and she was four at the time. I just started, up until that point, there were some things that were out of the realm of normal that I felt like, but again, I was dismissed, completely dismissed, just toddlers, like not a big deal. Um, but by this point, it was bad. Like she would wake up every day in pain. Her legs would hurt. Her stomach would hurt. And I hear that a lot, just in mom groups and just talking to clients. And I hear the leg and the tummy pain quite a bit. But she just would wake up and start crying and never stopped. And we went to school. I taught at the same school that they were at, and it progressed pretty quickly to like she would cry at home but not at school, and then it started to where she would cry walking into the building, and this was just like completely irrational, like didn't like the, very sensory, didn't like the way her shoes felt or her pants or her underwear. And of course, we're trying to remedy some of these things in the meantime, and thinking about like cognitive behavioral therapy for kids, and just trying to go down all of these like naturopath routes and detox routes and all of these things, and getting nowhere. Um, and the leg pain became so severe that they were sending me for x-rays, and they said she had a tibial torsion, and it was just leading me on this wild goose chase. And one of after Maddie's tongue tie, I was introduced to some therapists that do like a mixture of cranial sacral therapy and osteopath. And we were there for her leg pain. And she basically was just like, how is she sleeping? And I'm like, Susan, you know how she sleeps. Like, you know what I do for a living. She sleeps fine. And she was like, how is she sleeping? And I was like, oh, I got it. Like the quality of her sleep. And I was like, well, I mean, I don't think it's great, but I don't know what to do about it. And so she had gone down an airway journey before with a different doctor in the area who was no longer seeing patients. And she basically gave me two doctors' names and said, hey, there's this new dentist I heard about, and or you can try to contact this other guy. And long story short, I was able to get in with Dr. Hansen around the same time that her ENT appointment for her sleep study was scheduled. And so I had these two paths that I was going down, the traditional route with the ENT sleep study, and then I had Dr. Hansen. And I had seen the ENT, he basically dismissed it and said, yeah, sure, we can do a sleep study. We did the sleep study. We were waiting for the results. I had my appointment with Dr. Hansen, and all of this is happening right when I had Weston. So we had Weston, all of this started, and it could be, of course, having 4 kids. Like, it could just be the chaos of that. And a lot of people did dismiss it like that. Like, oh, well, she just had a new brother. Like, maybe it has to do with that. And, people are so nice and so friendly and want to help, but, they're not in the thick of it. And so it was like, it's just hard. And so, with that being said, I still appreciate everybody who has tried to help along the way, because it's gotten me where I'm at. And but Season introduced me to Dr. Hansen, and so we were able to get in very quickly. He did the assessment. I felt very validated. Everything up until that point was like a aha moment for me, even down to like, oh gosh, we already did the tongue tie releases and there was no therapy involved. And just, it was very eye-opening at that point. And I felt like I had somewhere to go for the first time. And really this whole journey, I felt like I had a solution. And so while we were waiting for her scans to come back after our initial evaluation, and he does draw records and he does a sleep study as well. So we did the sleep study, and I thought it was interesting because I had the in-lab sleep study and the at-home sleep study to compare. And I love data. And so that was really cool to have. And they essentially basically said the same thing. But the follow-up appointments were a lot different. When I went back to the ENT, I was basically laughed out of his office because he literally laughed and asked me if I thought putting a CPAP on a 5-year-old made sense. And he was like, I can do it if you want. And I was like, I was so shocked that he had the bedside manner to talk to me like that, first of all. And I think maybe a little bit of that came from me telling him that we were talking to this airway dentist also, which I know a lot of moms will resonate with, because when you are trying to go like a traditional route and, you want to give them all the information, like it comes up and then you're shamed for that. And so I hear a lot about moms feeling shamed for even thinking outside the box. And so I think a lot of it did come from that. But he laughed me out of his office and basically just told me if I wanted him to prescribe her a CPAP, that he would. And I felt okay because I had a different route to go, but I cannot imagine if he was truly my last effort. And so anyways, we moved forward with palate expansion with Dr. Hansen. We did myofunctional therapy to correct the oral, just all the muscle compensations, the tongue tie, strengthening the tongue to become the body's natural palate expander. And I'm on my own airway journey. All the other kids are on their own airway journey now. How I kind of found out about Toothpillow was he prescribes the same appliance. And so I don't even remember how me and you ended up getting connected, but it's cool because it comes full circle. And now I'm able to work closely with Dr. Hansen. And I have a lot of, I was struggling because I work with people across the United States to find airway providers in their area. And so Toothpillow was the perfect just solution for that, especially for kids that are under 12. And because we're a virtual company. And so I was able to join Toothpillow this year, and I could not be more grateful that I have the knowledge that I have on the sleep side, on the airway side, and the personal experience of being at that rock bottom and being in an office where you're laughed at and people just need to be kind, and they're not. And just know that you can get to the root cause of whatever it is. You just have to find the right people in your corner. And so I'm just so thankful that I I happen to come across just the right people, and I love getting to work alongside our team here in Oklahoma City so much. I really know why I'm here now, and it's just so cool because there are people in different professions that all work together. It's the most collaborative, like, type of healthcare I've ever seen. Airway dentists are amazing. They're treating the whole body. They're not just treating the jaws. And Dr. Hansen specifically has a just very unique understanding of that. So I'm just so grateful that I'm here, and we have such great resources. So
Yeah, and the few thoughts that I had when you were talking, going back to the ENT, well, do you want me to put your daughter on CPAP? And I'm just thinking, okay, if she's diagnosed with sleep apnea, like if she was in the NICU again and on the monitors, it would be going off multiple times a night.
yeah,
That is alarming.
yeah,
And then I think of, and also that fix is very much so a bit like it's going to help them in the moment. But like, finding Dr. Hansen and getting the expansion and fixing the muscles, it's getting to the root cause, and she's going to grow up into an adult that doesn't still need a CPAP.
right,
She's going to
right,
grow into a healthy adult
right,
and have healthier years leading up to that.
yeah,
And so sometimes when I see patients with sleep apnea be so dismissed, and it's not like, this is a big deal.
yeah,
Imagine,
huge,
okay, so when you look at let's just say numbers, like you have events every, you know, 20 minutes.
right,
It's like, imagine being woken up and put back down
yeah,
every 20 minutes and that
yeah,
disruption of your sleep. And I'm just like, this is a big deal. And when I see it dismissed or talked about, like, it's not
yeah,
a
no
big
big
deal.
deal.
It is so baffling. And talking about like the team, like I heard you mention cranial sacral therapy. Like I in our Toothpillow group, like I always love seeing the moms like tagging in other players, because
Yeah,
while Toothpillow is great, it's not always like we need to tag in other players. So we need to tag in the cranial sacral therapist. We need to tag in the chiropractor.
yeah,
We need to tag in a forward thinking ENT, or like an ENT that
right,
gets it and is it, because there are a lot of really great ones out there. Not to pick on the ENTs,
yeah,
because there are ones that
yep,
do listen and get it. Um, and so it's just such a collaborative approach, and um, it's really cool. So doctors like Dr. Hansen, who are, well established in their communities with these great networks, with their brick and mortar practices, are the same doctors that are virtually seeing kids who can't get to them. And
right,
I always try to really let moms know, like, when they're hearing about tooth pill, like, who are these doctors?
right,
And it's, because I work in the airway space, a lot of them to me are almost like these rock stars
yeah,
because I've seen like what they've been able to do over the years, and they're very well known airway providers. And so sometimes when I'm talking to these moms, I like want to make sure they know, like, you're
yeah,
being overseen by the best of best. Like Dr. Hansen, like, he is your provider, and people drive hours to see him in person. And
yeah,
so getting to connect underserved areas that don't have a Dr. Hansen, they don't have a Melina, they don't have that tribe in their immediate communities, but having a platform to be able to connect families to the people that are going to listen to them and not laugh them off, not dismiss things. It's just really cool to have that platform to be able to
yeah.
connect
It
all the
really
dots.
is. Yeah, and like you mentioned, like, could you imagine being woken up every 20 minutes? And, I think there's, a lot of just, we have a lot of resources for sensory kiddos, for kids with autism, for all of these things. But what if we took it a step back and looked at what's happening at night? Are the kiddos that are not breathing well, are not sleeping well, and they're not detoxing. Their body functions are not happening. They're not getting that rest and digest. They're chronically in that fight or flight. The ADHD, ADD diagnosis is like, I'm so thankful that we have great resources for that. But if we can just take it a step backwards and identify some of these other underlying causes and address those first, it's going to be so much better and more effective for these kiddos because they're not sleeping at night and they're not performing during the day. And I mean, yeah, we can gentle parent all like and just get on their level, but we're missing the mark with those kiddos that are not sleeping well because nobody's addressing it. And so, yeah, waking up
And
every 20 minutes, like they truly are. They're bedwetting, they're doing all of these things that are brushed off as being so normal, and it's not. And it all can be tied back to how they're breathing, which is fascinating.
yeah, I wish so desperately, just like they do vision checks and
Yeah,
scoliosis checks in school, like, let's start checking for tongue ties. Let's start
right.
if a child's misbehaving and really struggling in the behavioral aspect and so much so as being having to be placed in another classroom, has anyone asked can we do a sleep study? Can we
Yeah,
look how they're sleeping? Like, it's such a easy, non-invasive tool that and if it's not that, it's not like a big
yeah,
deal. I mean, we
yeah,
just took a peek at your sleep, you know?
right.
But I would be willing to bet a lot of times that's what it is. It
Yeah,
is sleep. And um, it's so funny to me that in our culture, our Western culture, we're so quick to jump to the extreme thing. Like, okay, you're misbehaving, you're whatever, so here's some medications to help maybe subdue you, but again, you're not getting that repetitive sleep,
right.
and there was no, like, "Let's peek at the sleep first." Like,
Yeah.
that's just so
Yeah,
crazy to me
it
that
is so
we
crazy. Yeah. Like, and parents talk about, like, the time, like, I don't have time for that, but a lot of people, um, go to speech therapy, right? And then they
Mhm.
plateau or they're in speech therapy for years, and it's like, well, the tongue tie was missed. They're not able to articulate that or, I know a girl that her son was diagnosed with apraxia and said that he wouldn't make it to kindergarten, like, he'd have to go to a special school, and it was all undiagnosed tongue ties and oral function. And he is now thriving. He's now in first grade, I think now. And, um, it's just to nobody's fault, right? Like they just don't know. And so that's why we're here is to spread awareness. And it's growing so fast, which makes me so happy because people are jumping on board. They're realizing how important it is. But I do hear a lot like, "Oh gosh, I don't think I can afford that or have time for that." But yet they're spending, the same amount in speech therapy or these other therapies, and I guess that's what I was trying to get at is like we're doing all of these other things without checking the quality of their sleep first. And if we can just get moms to realize like, "Hey, these are the red flags. If you see this, let's start here first." Or just pump the brakes a little bit and just reevaluate. And yeah, so it's really cool to see these kids' transformations so quickly and the symptoms get better so fast. And yeah,
yeah, it's cool because I knew about, like, airway dentistry and I saw other stories, and that
yeah,
was super cool.
yeah,
But then when you experience it with your own family, you're like, "Okay, that is really cool." Like,
yeah,
it's so cool the, um to see it work with your own like, you okay, there's no like, that's my child, I knew who they were before, so, like,
right.
this is really, really cool, but and I'm just so thankful, that you were able to join our team. We at Toothpillow have a really amazing way of just organically finding the best of the best. They just kind of find their way to us. And it's been so helpful because just like you've done with everything, your infertility, you helped moms, your feeding struggles, you turned it around to help moms. Then you went through um, the airway struggles, and then now you're able to turn it around to help other moms. So we couldn't be more thankful to have you on this team. And I'm so excited to share this podcast episode. A part of me is like, I just want to take the raw, unedited one and just post it to our Facebook group because I'm just so eager for other people to hear because it's just your story is a lot of other moms' stories. And
Yeah,
just sometimes when you know some when you get to, like, hear somebody else going through it, it means a lot, and so I just wanna say thank you so much for being
You're
here.
so welcome. Yeah, of course. And I know I'm not the only one out there. And so I'm always an open book if anybody has any questions or, you just are feeling like, gosh, my kiddo sounds so similar. What do you do? And we did end up doing a naturopathic route as well. And so I'm happy to share resources of what I've learned there too. But we're definitely, just continuing this mission to help making sure that our kids are growing and thriving and they have all the resources and families, parents have all the resources that they need to ensure that their kids are the best that they can be. So
I'll go ahead and end the podcast here, and again, I just wanna say thank you so much.
you're so welcome.